Good morning, everyone, and welcome back to another Conversations from Stritch. It's really good to be with you again. I'm joined once again this morning by Dr. Christopher Sint, our provost, and we have a couple guests that we'll introduce in just a few minutes. I just want to open up today by saying that things really feel like they're starting to come to life on campus. It's not a lot of activity, but when you're used to virtually no activity on campus, seeing just a few more employees be back, faculty checking in on their offices, we will have more students moving back in terms of those people that are doing their RA training and other things in the next couple weeks. And now we are, getting close to 2 weeks away from the first opening of classes. So it's exciting. It's an exciting time. I want to recognize, and we're going to talk a lot about this today, that there's also a sense of pressure growing that we feel from some of the questions that are coming in to ask us, even in the interim. Families that have a lot of questions about very specific things, about how move-in is going to happen or how this specific thing is going to work. And over these next couple weeks of the show, we're really going to try to address those. So I'm going to take much less time this morning of intro and just say we're excited to have you on with us today. We're going to try to answer as many questions as we possibly can this morning, give you a little bit more detail from our health center's perspective and from how we're responding to students' questions relative to classroom and a whole other residential and a whole other host of things. So with that, I really would like to turn it over to Dr. Sint. So Chris, thanks again for being here this morning. It's exciting. Like I said, there's a growing energy on campus. Certainly there's a growing sense of trying to get all these questions answered, get everybody back on campus in a really safe way. And I'm going to say for, I think, the 15th time, that everything that we do here is really balancing out the health and safety of the whole community, our employees and our students, with delivering educational excellence across a whole host of platforms. And the students are now used to different platforms, but as they've looked at their schedules, they're seeing their schedules really have these different aspects to it. And so maybe we can start out with just your opening comments and then some questions that have come in the last week, some specific ones, and then introducing our guests.
Yes, thank you, and hello everyone. It's great to be with you, and I agree it's great to be here on campus and seeing the preparation of the semester take shape. And I know many of our community members, faculty especially, are home preparing for the semester, but we know that they are in deep preparation mode by now. I do want to one thing I would say quickly is that we are reading all the questions, and to some people who are asking extremely specific questions, we're reaching out to them individually. So I'm going to respond to a couple of broader questions right now, and then, but if you have sent in a question, we will respond to you individually, if not for the whole group today. So one maybe general comment I'll make is that we're continuing to refine the schedule for the fall, and if anyone is interested in making adjustments to their schedule, it's not too late. If you want to think about a different day of the week or going online instead of coming to a blended class and so on, please contact your advisor and contact academic services, and there's still time to make adjustments. The second thing I would say, and last thing I would say, is just to make an announcement that's fairly specific about the commuter meal plan. So people have asked about, they've basically said, I'm going online for the fall semester, or my choices have been to go online for the fall semester, and but it's a standard charge to be charged $25 for the commuter meal plan. And so we're just saying today that if we will check the schedules after the semester begins, and for students who are fully online for the fall semester, they'll be refunded that charge. And we're still kind of working through the topic of parking and how exactly to address that, but we will probably talk about that next week. I think those are my only real announcements to begin with. Our focus today is really on two things. One is to talk with our Vice President for Mission and Associate Provost for Academic Affairs, Schackmuth, who is going to sort of talk us through the welcome week, the first couple weeks of class, move in, and so on. And he's representing a lot of other people who are doing all this amazing work to prepare the campus and to prepare the student experience for the fall semester. And then we'll spend spend the rest of our time, which will be a significant part of time, talking with Lori Forbear, our Director of Health Services, who will sort of talk through in a more comprehensive way how we're responding to health and safety and the issues that come up around COVID-19. So first of all, Kurt, welcome. Great to be with you.
Hi there. Good to see you both.
Thank you for joining us.
I gave kind of a general introduction to you, Kurt, and I'm going to leave it to you. I know you're speaking for a lot of people, and you know, really, I think our reason for asking you to come on this week is really just so people could start, families at home, students at home, especially could start visualizing what those first few weeks are going to be like between coming to campus and starting class, and how this year might be different than a typical year.
Yeah, you know, there have been a lot of people in dozens of departments and offices across the university that have really been planning for the return of our students. And Welcome Week is really the point at which all this planning is going to come together, hopefully in a really great way. So it really all begins on August 23rd. That's a Sunday. And that's when our first-gen flyers and our student success scholars move on to campus to begin their programs. And then shortly after that, the next day, Monday the 24th, a phased-in move-in process begins for our new first-year students who are going to be living in the residence halls. And we've created the system. Fred Gandy and his team in Residence Life have created the system where they'll move in phases, a number of students each day over the course of 3 days, the 24th, 25th, and 26th of August. And as students move in each day, there will be meetings in the residence halls to get students together, to help build community both in person and virtually. And it'll be a great opportunity for students to just begin their college experience, get acclimated, make some friends, and get ready for the rest of the week. And so the rest of the week will include all kinds of activities, both virtually and in person, as well as some curricular components. And so our Cornerstone seminar, which is designed to accompany and support our newest students, our first-year students, through the entire first semester of college, will begin holding classes on Welcome Week. And so the first class will take place on Wednesday, August 26th. There'll be another one on the 27th and a third one on the 28th. And the academic services team and the 40 or so first-year mentors who are faculty and staff members who teach this class, they've been working on making some modifications to the curriculum, and they have a number of great activities set up for those three Cornerstone seminar classes. And so there'll be icebreakers and community building activities. There'll be orientations to health and safety protocols that we're all by now very familiar with, but are even more important now as we bring our students to campus. There'll also be a review of course schedules, and we'll show students how they can find their classes on campus and what that means if they're taking classes online. And then on Friday the 28th, students will participate virtually in our first-year flyer convocation, which is a formal ritualized way of welcoming our first-year students to campus, but also to a scholarly community. And also it's a way to kind of introduce them to the mission, the Catholic and Italian mission of Lewis University. So these Cornerstone kind of learning communities, we're calling them, will unfold over the course of Welcome Week. And there are even sessions that are set aside for students who need to participate in those classes virtually as well. On top of that, there are all kinds of activities that are being planned by the Office of Student Activities and other departments on campus to really engage students in socially distant ways and in really safe ways. So there'll be a movie on the green, there'll be videos that video games that students can play on an inflatable large screen out on the green. There'll be crafting activities and other kinds of games that students will be able to take part in through Welcome Week. So, Welcome Week this year is definitely going to be different than it has in the past, but I don't think it's going to be any less fun or any less engaging. And I think it's going to be a great way to welcome our newest students and get them excited about being on campus and getting ready for the first day of classes, which is Monday, August 31st. So it should be great. And of course, all of our returning resident students will be coming back too. So it's not just for first-year students. It's also an opportunity for our returners to come back, and it's also a chance for commuters to get involved. They can come to campus and take part as well.
Yeah, and I was going to ask you about the commuter issue. So for first-year students and the first-year convocation and the Cornerstone class, that applies to all first-year students, not just residential students. Just so those that are watching, and I know they're getting all this communication, right? So they're receiving all of this in the mail and email and I'm sure multiple formats, so they make sure that they have it. But this is for all of our first-year students.
Yes, that's right. All of our new students, first-year students, commuter or resident students, are registered into a Cornerstone seminar class when they come through SOAR and when they meet with an advisor. And so they'll all be partaking in this class.
Yeah, that's great. Thank you.
Kurt, thank you so much. Could you maybe you said this, but could you speak a little bit more about the variation between what things are virtual and what things are in person? That from the list that you just laid out.
Yeah, most of the activities that I mentioned are the in-person activities, and the Office of Student Activities is in the process now of finalizing all of the programming that'll take place during Welcome Week. It basically will allow for the students that are unable to come to campus to still take part in some activities online. And I don't have the final specific list just yet because they're in the process of wrapping that up now. The ones that I did mention are the ones that are likely to take place on campus, though. But I really think the residence life staff has been pretty creative in terms of their own programming around how they're going to engage students in the residence halls. And so there'll be ways for students to get to know each other, for their RA to get to know the students through various different virtual platforms like WebEx. There'll be WebEx meetings in the residence halls to keep students engaged even if they can't come together on a regular basis. So people are being really creative in their approaches.
So Kurt, you mentioned move-in, and we've had a question come in just in the last minute or so about the role of parents in terms of move-in. And I will try to read into this question a little bit just because my niece is leaving tomorrow with my sister to go move in to a school. And I think some campuses are basically saying parents won't be involved in move-in, the staff will be. Other schools are, spreading out the time and saying parents and students can move those boxes into the residence halls because we're spreading them out. So could you just talk a little bit about the role of parents, kind of on move-in day and how long parents are going to be there, what their role is in terms of moving kind of boxes and other things in, and then in some sense maybe when parents will be asked to leave?
Yeah, so I don't have the full details on the precise answer to your question, Dr. Livingston, but what I can say is that this phased-in process over 3 days is meant or is designed so that students and parents can move their students' belongings into the residence halls in a way that allows parents to participate. And then unfortunately, there'll be less activities for parents to engage on campus during the move-in process or after the move-in process than we've done in the past. But that is for health and safety reasons. And so in the past, we've had large picnics and large gatherings on campus where parents and students could all come together. And for obvious reasons, that won't be happening. But as far as I'm aware, parents will still be able to take part in the move-in process. And we're able to do that because we've spaced students out over the course of 3 days of move-in.
And I guess the one thing that I would say to add to that, and I don't think this is overstepping, Fred or other people on that, is just that I hope that when parents come, that you take advantage of the campus is a beautiful campus. We have a path that goes through the woods. We have nearly 400 acres. So there's a plenty of room to social distance, I guess is what I'm saying. And as you're saying goodbye to your daughter or your son, though we might not have big activities because, welcoming a class of over 600, we can't put 1,800 people in the same space like we may have done in past years. We really want you as a family to take a little time to drive around campus or walk around campus. You can be social distance from other people so that when you say goodbye to your daughter or son, you feel like you've gotten to know the campus a little bit and we want you to feel like your child is going to be taken care of and is going to be safe on campus. So please take a little time to get to know campus, even if we don't have these structured activities for you as a parent.
The other great thing is that Family Day is going to be taking place on September 13th. And so that's another ideal time for parents to reconnect with their students who are living in the residence halls, or for parents to just simply come to campus and connect with their students. And more information about the structure and the schedule for Family Day will be coming out soon from the Office of Student Activities. And so in addition to what you just said, there's other opportunities as well in the future.
That's great, Kurt. So I would like to, while you're still with us, change the subject a little bit and ask you about one more thing since we have you here with us. When you were last on the conversations with Stritch with Dr. Christy Kelly, we were focused on preserving Mission through the fall semester, preserving our approaches to diversity, equity, and inclusion. And one of the topics that came up that day that we presented on that day, was this level of support for students who are being asked to do a lot more online learning or learning at home, who may not have access to all of the technology that we typically would require of our students. So I think we have some, we talked about how we have loan out computers and Wi-Fi hotspots in addition to other support for those communities. But I think we have maybe a little update on that you can share this morning.
Yeah, so now is the time when students start to assess their kind of readiness and preparedness for the start of the semester. And we know that because there are students out there who may not feel fully equipped to take classes online or to shift into this hybrid learning mode, we know that there's some students who may be struggling to make connections to the internet and who may not have the best equipment at home, the best laptop computer that will allow them to learn and to learn well and participate in their courses. And so thanks to the collaboration of a lot of departments on campus, we've been able to put together a program called STAR, Student Technology Academic Resources Program. And the STAR program essentially will allow students to borrow laptops and Wi-Fi hotspots that will fulfill a need that they have, and at the same time help to support their success during the semester. And so there's a website you can go to. It's on your screen now, lewisu.edu/STAR. And students who are interested in requesting this equipment can fill out the application, and that will allow them to be considered. We really need them, though, to apply by the 24th of August, if possible. That will allow us to take a look at the needs of all the students and to determine the process of getting that equipment to them. So we're partnering with a lot of different departments, the Center for Academic Success and Enrichment, the library, definitely the Office of Technology, and financial aid and other departments are all kind of coming together to support this program. So we're really pleased that we're able to do this to help our students, because it's all about student success and helping them to really navigate these challenging times.
That's great. Thank you so much, Kurt, for that. And again, that website was there. We will. I'll be sending out an email today to the community that has that detail on it about the STAR program, and so people will have a chance to refer to that website.
It's great.
It's quite similar to the COVID-19 Relief Fund application. If you have filled that out, it's a similar
And
process.
we do want to make people aware that
Yeah.
that is still available. We've been really pleased with, and I don't know that we have many of our donors that are watching this program, but our donors have been very generous with supporting the COVID-19 Relief Fund, understanding that many families within the Lewis community have lost jobs, whether it's the student who has lost a job or a parent that has lost a job. And there's an application, as Chris said, associated with that fund. And the support has been great, and then the students who have asked for it, it's really helped them to see through that they can get through the semester financially and schedule for classes, because some of them were worried, can I do that? And so if you still have questions about that, that application for the COVID-19 Relief Fund is still available online. You can fill it out, and the financial aid office will get back to you with there are varying degrees of amounts that are available based on what your circumstances are. So I know we're going to turn it over to Lori, but
that's wonderful. Thank you so much, Kurt. We hope you stick around. There may be questions that come in, and we'd love for you to be with us here for the hour. But now I'd like to introduce Lori Forbear, who is our Director of Health Services here at Lewis, and has been doing just incredible work, as everyone can probably imagine, over the last several months, and as the university has taken a completely different and accelerated approach to health services and to our response to COVID-19. She's been an absolutely incredible and integral member of our team, and has been a great resource. We sort of waited until later in the summer to bring Lori on the show, or ask Lori to come on the show and to present our kind of approach to health and safety, especially around tracing positive cases and things like that, because the information is really evolved over the summer, and I'm glad we waited, because there has been quite a lot of changes in both the advice that we're getting, as well as the science around it, and in terms of our capacity and ability to do various things that are happening across the country. And so so welcome, Lori. Lori has a fairly extensive presentation to give, and so I'll ask you to take it away with that. And I know there are some slides involved, and we'll try to engage in conversation around it as you go through some of the information that you're sharing.
And Lori, I just want to second Chris's welcome and appreciation. I know you have a lot of material to share, but 20 seconds of just me saying how grateful I am to you and your whole team, but especially your leadership in preparing the campus for students returning, and really working so diligently over the summer to make our employees and our students feel that they can return and remain healthy. So thank you for that.
Thank you. It's been my pleasure, and we've all worked closely and learned a lot as we've gone and continue to learn. And I feel like we have good plans in place, and I'm going to give an overview of some of those today. I know there are some slides to go up, so I will talk as those go along. So the first one is an overview of resources that are in place for return to work and for students. So the return to work guidelines are issued by Human Resources, and they are accessible on the web pages. The flyers promise and acknowledgement went out, and we've had a really great response to that, and we continue to get responses. There's a lot of information in it. We did try to keep it as succinct as possible, but it's a lot of information to share, so we wanted to be sure that it was inclusive. It also leads into the Health Services website. There is a web page on the Health Services website that is COVID-19 information and resources that is dedicated to specific COVID-19 questions, concerns, prevention, education, and links to current up-to-date public health information. We will be keeping that up to date as new guidelines change. We felt it's important to link directly to the sources because oftentimes they do update, more than once a week. So we will give an overview there, provide a lot of information, and if there's any requests for anything that we don't have up there, we can certainly accommodate that. But we'll be adding to that. We'll be updating our information about the services available in the center as well. So the fall 2020 campus plan and the health services COVID-19 information and resources page will be excellent resources for people that are seeking specific information. I encourage everyone to review those and check back weekly because, as I said, updates will be posted and information may change. We have been working closely with public health agencies and monitoring the guidelines that come out from CDC, Illinois Department of Public Health, Will County Public Health, American College Health Association, and we have stayed up to date on those and adapted our plans around those best practices and recommendations.
Lori, let me
Yes.
pause there and ask you one question about the Flyers Promise, because we talked about this quite a lot last week, but I guess I'll say first that the Flyers Promise is an overriding sort of umbrella pledge that all of our students and all of our employees embody or take that has to do with keeping oneself healthy and keeping our community healthy through behavior and habits, both on campus and off campus. But I want to maybe ask you to zero in a little bit about what we're calling the acknowledgement on that slide. As you said, a kind of a detailed set of expectations for students on many topics. So could you just give a little bit of a sense for people watching that didn't have to read it and sign it and so on? Like what were students presented with that acknowledgement?
Sure. So within what we're calling the acknowledgement that is coupled with the Flyers Promise is information about our face mask policy, protocols for what to do if there is a need to report a positive COVID-19 test, our communicable disease policy, an overview of symptoms and educational resources. And most importantly, I feel like it was a place to house just providing the information to students so that they know where to look when they need information. They've been made aware of the process and the protocol, and they've been given the resources and several areas to find that information should they need it.
So it's just a good reminder, because I think sometimes when I'm presented with something to sign like that, I sign it and I read it, but I forget that it's full of information. So even if you've signed it, and over 1,000 students, many over 1,000 students have signed it, please remember that it's full of really great information that you can go back to.
Yeah, and it's another, so like the website, which the Return to Campus website, this is just one more source that we hope, and we said this last week, we hope that people will return to these things over and over through the semester. As they may feel a question that comes up, there are these resources that are available to them. And
this is maybe before you go on, Lori, I forgot something I was going to announce at the beginning. This is maybe a good time, is that if you have not downloaded the app, which is, I have to look, Lewis, I don't want to make the same mistake 2 weeks in a row. What is it called? Lewis U app. Please do so. That it's a great reading the acknowledgement and the promise and the acknowledgement on the app is really easy to do. But there's lots of other really convenient resources if you're if you prefer to use apps rather than navigate websites and so on. So it's really growing every day. So please check that out. Okay, Lori, you can go back to the presentation.
And I'll add one more thing. We felt it was important to provide videos within this content as well, because not everybody is a research nerd like me and likes to sit and read lots of words on paper or click through links. So there is also some video available for people to watch, just to get the information in a different mode.
Great.
So there is a process in place to report a case or suspected close contact with a COVID-19 individual. The COVID-19 is a communicable disease which falls within our communicable disease policy, which states that cases must be reported. That policy is found within the acknowledgement and also in the student handbook. We have established a team to manage a COVID-19 hotline. There's an easy to remember phone number and email address that, should someone need to report that they've tested positive or have any concerns, they can reach out either through the phone number or through the email. This information will also be accessible on the Lewis U app. So it would be, very convenient to just click on that section and make the call or send the email. It is monitored, and there will be a response from a hotline team member within 8 hours. And then we will just discuss with the person on an individual basis what the circumstances are.
I think, yep, okay.
So like I said,
I think, yeah, you can go on. Let's go on to that next slide if possible. And then we'll probably have some questions about the process when you're done talking through it.
Sure. So like I said, a hotline team member will reply within 8 hours. It will be monitored at all times. And then as required, the Will County Health Department will be notified of positive cases. We are required to follow the guidelines and directives that they will issue, and those requirements and directives will be issued on a case-by-case basis for each individual situation.
Great. So,
part of the flow, oh, sorry, go ahead.
oh, no, you go ahead and finish, and then we'll have some questions.
In addition to us receiving this information and acting upon it, there will also be the activation of any response and support services, which includes human resources, housing, dining, custodial, and facilities.
So we just maybe want to talk through like how this might feel, how it might work. Clearly we know that people who would be calling the hotline, are under, it's a stressful situation to have to go through this for anybody. And so we just kind of want to maybe visualize a little bit what it's going to be like. And so the team itself has how many members on it? Like 5 or 6 or 7 of people who are trained to talk with people. And then what kinds of questions, so they leave a message or they reach out to the hotline and we get back to them within a few hours. Then what kinds of questions would people expect to be asked?
There will be, and I just want to point out that this entire process is confidential. It's kept confidential. Yeah. So reporting it to the hotline, your confidentiality will be maintained. There are screening questions, the basic information we would gather that is required to be submitted to the health department, but also to help us determine, what the implication is for the student and what resources they need. First, we would address, have they consulted with a healthcare provider? Do they have any questions? And we would certainly answer any questions they have, initially making sure that they are feeling well and stable, and then go from there. Mm-hmm. We'll be providing them with information on next steps and kind of an overview of what they can expect if they do get a phone call from the health department, and what to expect if they're currently having symptoms or if they're not having symptoms and symptoms develop. we will provide them with, I always feel comfortable providing way more information than somebody may ask for, because I know with myself, I'll hang up from a call with a doctor or leave the appointment and say, no, I don't have any questions. And then I will think of them as soon as I leave. So I always like to provide resources, but the reminder that we are available. That's not your one-time chance to speak with someone. We are available. Health services is available, and
Yeah, thank you, Lori. And could I just just a little, I guess just playing off of what you said earlier, Chris, this is, an anxious time. If somebody gets a positive test, one, they might not be feeling well. They might be really frustrated. I can't believe I got this. They might be, worried about what other people might think, and all the things that you said, Lori, about it's going to be kept confidential. But I just want to go back to the Flyers promise. At the kind of in the first couple sentences of the Flyers promise, it's about taking care of each other and ourselves. So protecting our own health and protecting the health of the broader community. And we're pledging that to each other because we do care about each other. And so this hotline is available to help somebody through, in which we have a group of people that are going to help you, if or whoever might. I could be sick 3 weeks from now with COVID. So we want to help you, but we also are asking you to tell us, because we want to make sure that that we do the appropriate contact tracing, that we let people know, but we're going to do that in a confidential way, so that the overall Lewis community is really being protected by people reaching out to this hotline. It's not in any way punitive. It's really a matter of fulfilling that promise.
Yeah, so I think you, President Livingston, just answered one of my questions, and we just had a question come in. I'm going to try to translate a little bit. So it's about who uses the hotline. Maybe you could just go over that one more time. So certainly it's a requirement in the acknowledgement and in our policy around communicable diseases for people to report positive tests, right? I think I said that right. So the hotline is a way to do that. But are there other reasons why people would call the hotline, I guess, is the other question.
Sure. The hotline can be used as a resource if someone has questions and they haven't been able to find that information elsewhere, or just if they have tested positive. And just as questions come up, because like Dr. Livingston said, it can be overwhelming, and you can, just may have questions come up that you need answered. So they can certainly reach out to us with that. And if we will direct them to the proper department within the university, say if they need any academic support, or if it's going to impact, any of their coursework, we can be the link to connect them with
Lori,
where they need to be addressed.
Two scenarios that I guess, and this may come up in your next slide, and so I might be pushing this a little bit, but I guess two scenarios. Hotline, is it used if I've read the level of symptoms and I think I might be symptomatic, but I'm really not sure. I guess secondly, maybe I'm working a part-time job as a student, and one of my coworkers tested positive. I don't really work with them that much. Is that a place where I could call the hotline and say, I work in the kitchen, they're out as a server or a hostess, but they did end up positive and they're now quarantining. Do I need to get tested? Should I, what should I do? Is that this kind of generalized question around, have I been exposed? Are my symptoms worthy of getting a test? Those kind of things.
It could be a resource for that type of a question. We would always encourage somebody to speak directly with their healthcare provider if they have concerns about their own health. But I would like to enforce that when we, and this may be jumping a little bit ahead for myself, but when we are notified of a positive case that is someone within the Lewis University community, when part of our interview with that individual is to identify the close contacts that they've had based on the current public health CDC guidelines of within 6 feet for 15 minutes or longer. And then those individuals would be contacted by a university representative. And then, outside of that, if you're not contacted by us, you are not found to have been within that close contact criteria.
Yeah, and I think that's really helpful, Lori, because we all hear about this contact tracing. Most of us are not expert in it at all. We just hear it all the time in the news. But also what you're saying is, we will do contact tracing well. And so, you might have been in a classroom and then you hear through the rumor mill that this student that sits 3 rows over has tested positive for COVID. If you haven't been contacted, you're not somebody who was, as you say, within 6 feet for 15 minutes, et cetera, et cetera. So, we will do the contact tracing, and in some sense, I don't want to say you don't have to worry about it, but you will be contacted if you are in that vulnerable population.
Yes, I want to
Yes.
clarify one other thing before we get off this very specific topic of contact tracing. It's also possible in that example that you gave that a student or employee of Lewis will be contacted through a different contact tracing process, even in another county or what have you. And in that case, they should call the hotline because we wouldn't be informed necessarily, right, Lori?
Yes, that's correct.
If it doesn't happen on our campus or, and so on,
So it's that go to Labor Day weekend at your aunt's that's over in
Yeah.
Iowa, get contacted by a contact tracer 4 days
Right.
later.
we
That's
want to know that
Right.
if that happened. So that would be a call to the hotline. It wouldn't be something we would already know. Whereas
Yes.
we would if it was on our campus. And so that is a transition into just a couple more questions about the Will County Health Department and our liaisoning with them. So the process that you laid out, Lori, students and employees call the hotline, they get a response, they go through that process of asking questions and doing information, and then the hotline member, probably you or another nurse on the staff, contacts the Will County Health Department, and you kind of liaison the response. I mean, they make the calls about what the outcomes will be in terms of quarantining or so on, but you would be the one that they would communicate with, and then you would communicate back to the students or the employee.
Yes, correct. We will take our directives from the county health department officials and pass that along to anyone within the Lewis community that's impacted.
You mentioned earlier that the county health department might contact somebody. Would that be because they want more information related to contact tracing, or,
Typically, they will definitely contact the positive individual because they will need more information than what we may have been able to get, and then they can confirm the positive test on their end through their database. And then if needed, they will, reach out to them again. So there is a chance, and I like to clarify in any discussions I would have with a positive individual would just be a reminder that the information we're gathering from you is similar to what you may be asked by the health department, but it's still important that you talk with the health department, answer those calls, and even if it seems repetitious, it's important for you to communicate with them.
And I just want to say one other thing, because I know how important it is that we emphasize that every case is different and unique. And so that could happen, what you just described, and they also might not need to contact the person and we would be the only connection to them. Is that also
Yes.
true? Okay. So it's really,
Correct.
it's hard to describe exactly what people could expect because every case is different and the information is different and the timing is different and so on. But calling that hotline is the way to ensure that the process is started and will come to its full go through its full cycle. So maybe now we can go to that last slide, and we interrupted you in the middle of talking about the different responses that we have at the end of this process.
Yeah, and I would just say, when in doubt, the hotline or reach out to us by email. So again, as part of the process, the support services will be offered, or the individual will be guided toward those, and then communication with anyone in contact with the instructors and support services would be made. We would review their return to work and return to in-person activity classes guidelines, and make sure that they have an understanding of the instructions. And this is the beginning of the flow chart to kind of give an overview visual of how this process works. So on the left, it's if you were exposed or notified that you may have been exposed to a positive or presumed positive individual, your step would be to quarantine for 14 days. So this would be the situation, like Dr. Sint mentioned, if someone has been contacted by a different health department, to let them know, hey, when you were out of state, you may have been in contact with someone. So that would be a step to notify us, and that would be a quarantine situation. The bubble on the right is for a positive COVID-19 test or a suspected positive. And I say suspected positive as in you've spoken with your doctor. They believe that all of your symptoms you're having fit the COVID-19 diagnosis, and they call you a presumed positive. So it's treated as if it's been diagnosed by testing. And then that requires isolation for their specific timeframes. And the current CDC timeframe for that is for a minimum of 10 days plus 24 hours without symptoms. So it could be longer than 10 days. But what's really important, again, is this is addressed on an individual basis, because if somebody is having symptoms, they need to be evaluated by their healthcare provider to ensure that their symptoms have resolved within that time frame, and given that extra 24 hours symptom-free before they can be cleared to discontinue isolation.
And before going on, could you remind us the difference between quarantine and isolation?
Yes, so quarantine is when there is a known or potential exposure to COVID-19. So that means that you quarantine for a 14-day period. There is no way to shorten that period. A negative test within that 14 days does not shorten that quarantine period of 14 days. So that is another thing that's discussed. We would calculate with an individual their date of possible exposure, and then we would calculate their projected quarantine end date. It's important to keep in mind that while you're in quarantine, if you have another exposure, your quarantine is based off of your most recent exposure. So if you are on day 2 of quarantine and you had contact with another household member, or were notified that you've had another exposure, your quarantine period, another 14 days would begin that day. So it would add an extra 2 days to your initial quarantine period.
So quarantine is for individuals who have potential exposure, and isolation is for people who have a positive test or a suspected positive, I think is what you called it earlier.
Or symptoms, yes.
Okay.
And so somebody could, you used one example, Lori, of I'm quarantined and then I have another exposure, and my quarantine was going to run from the 1st of September to the 14th of September, but now on day 4, I get another exposure and it now moves to the 18th of September. But it's also possible that I could move from quarantine to isolation, because I could have gone to quarantine, and maybe, not everybody will, but some people might get a test at some point while they're under quarantine or right before they go into quarantine, and then they find out the results of the test 3 days later, it's positive. They're going to now move from quarantine to isolation because now they're an actual positive case. They'll isolate for 10 days, or it could be 20 days, because it's just until they're symptom-free for 24 hours at the end of at least 10 days. So these are all fluid dynamics that are happening for people. But as Chris said, and as you mentioned, for people to think about it, quarantine is, we don't know whether you're sick or not, and we're going to keep you in quarantine for 14 days because we don't know. It's a kind of, there's a big question mark above the word quarantine, and there's an exclamation point for me above the word isolation, because we don't know in quarantine and we do know in isolation, and they function differently in terms of protecting you and protecting the broader community.
That's correct. And I would just say the quarantine period is set for that 14 days because COVID-19 symptoms may develop within 2 to 14 days of exposure. So you really want to make sure that you've completed that window of time. And like you said, Dr. Livingston, if you develop symptoms during your quarantine period, that does put you into isolation and testing. Current guidance from the Will County Health Department is that if an individual begins quarantine, it's advised not to test before 5 days, but you still would remain in quarantine even if you get a negative test.
Excellent. Thank you so much
Thank
for those
you.
clarifications.
Really helpful.
So I think we're ready to look at the end of the flow chart now, which is I think the final slide.
Mm-hmm.
Okay, so kind of describe this, that we will contact the individual who's reached out to us within 8 hours. It will be a quick turnaround. And then once we've gathered the information, we will notify the county health department and work to activate any appropriate support resources. And we will circle back with the individual after we speak with the health department, and they address each on a case-by-case basis. I can't stress that enough. And then we will provide the directives that we've been given from the health department to pass along to the individual or anyone identified to have been a close contact within the Lewis community.
Great. Thank you so much.
Mm-hmm.
Oh, it does go on, so I apologize.
I think this is the final step of it. So the faculty and staff should communicate with their supervisor and human resources, and students should communicate with their instructors and support services if they need any additional support. And then just follow the directives for return to work or classes, which are outlined in the policies.
So this might be not really intuitive to people. So that the top of those two, that rectangle. What do people communicate to their supervisors, and what do they communicate to their professors if they are at that stage?
They would need to communicate their absence. I don't think they need to go into specifics. Just for, say, a student, they would let their professor know if they're in hybrid classes that they would need to do remote learning for a period of time. And then faculty and staff can communicate with their supervisor or directly with HR to discuss what they would need to do. Some people may enter quarantine or isolation and be well enough to continue to work remotely or to continue to do online coursework. But you know, if you're not feeling well, you certainly aren't going to be able to do that. So it's important to communicate what your needs are to the appropriate department.
Yeah, and I think it's important, you know, this balance between, I think what you're getting at, Chris, is there's a level of confidentiality and there's an expectation of communication. So if you're a student and you're going into quarantine, you can just tell your professors, I won't be in class for the next 2 weeks. And you don't have to say it's because I'm quarantining because of COVID. You may say that. That's up to your comfort level. The same thing would be, you know, an employee can reach out to their supervisor and explain the situation. Now, we have a sick policy and all those kinds of things that's different than taking PTO. And we certainly don't want an employee to take PTO because they're in isolation because they're sick. We want them to take their sick pay. So it's this, we want people to be comfortable that their health information is being held confidentially. And we also want people to feel comfortable communicating with their professors or their supervisors, and explaining that I'm in isolation or I'm in quarantine if you as the individual are comfortable with that.
And I'll just reinforce one other thing that Lori said, which in addition to all of that, which is what I was getting to, each case is so different in terms of its symptoms and the way that it plays out, that it really is a conversation with the professor or a conversation with the supervisor around where the comfort level is around what can be done, whether it be done, what kind of work can be done virtually.
And that's going to change over time, right? So I might feel great the first 4 days that I'm in quarantine, and then all of a sudden I start getting symptomatic and I can't do my work.
Yeah.
So that's going to change. If we could bring Kurt back up, unless you have I guess I wanted to, just for the whole audience, my own experience of this conversation, each one of these shows is a little different, but I feel like, and I hope I'm very excited about the start of the new year. It's been a long time since we've had students on campus. We're also very cautious. And so this program is a kind of balance between the excitement that Kurt was trying to express about Welcome Week and welcoming people back and all that. And Lori, we are prepared from a health perspective to make sure that our community remains safe throughout this excitement. And it feels to me like we face this in so many areas of our life. There's the excitement of driving an automobile, and there's the responsibilities that go with getting behind the wheel, and we make you take a test, and we make you take a class, because there's real responsibility that goes with driving a 1-ton vehicle made of steel down the expressway at 65 miles an hour. But it's liberating and it's freeing and it gives you all sorts of opportunities. And we want to balance out the responsibility the community has with the excitement we have of people coming back to campus. And that's really, this show is trying to balance those two things out, which are the constant balance that I think the whole team is trying to achieve. And we recognize that people in the broader community of Lewis have a level of anxiety, so we want to name that out loud. And there are responsibilities that go with returning to campus, but we feel that we can do that in a responsible way. And Lori and her team are making sure that we're complying with all these guidelines. But we're excited to have you back, whether you're an employee who's been working remotely for a long time and you're going to be coming back, or a student who's going to be having some of these hybrid classes, or a lab that's fully in person, or you're going to be back in the hangar working on planes. We're excited to have you back on campus.
Great.
Questions that you may have for either Kurt or Lori?
I do think I know we're running a little long on time, but I do want to maybe bring up the topic of testing. And I announced last week, or we announced in my message last week, that we are not requiring a positive test upon...
negative test.
No, I'm sorry, yes, sorry.
You must be positive for COVID before you can come to campus.
No, we're not requiring a negative test as an entry into the campus for the fall semester. And I just wanted to maybe ask Lori to provide some context for that approach in relationship to the guidelines that we're getting and the advice that we're getting from our authorities. And then maybe we can talk about testing a little bit beyond that, but maybe that's the first question.
Yeah, so the CDC does not recommend entry testing at this point, and American College Health Association guidelines do not support routine mass screening either. So in alignment with public health recommendations, that would be the reason for that decision.
So I know this is complex, but could you just say maybe a word about what the reason is for that? Like, what's the why doesn't it work, or why is it not a useful tool?
So testing, it's important for testing to be done at the right time. Too soon after a potential exposure could result in a false negative, and that would give a false sense of security. It's also important to remember that the test is a snapshot in time. So if You get a test 2 weeks ago, unless you have, been in a bubble, you've been out and about, and there's a chance you've been exposed. So a negative test is not the be all end all and doesn't say that, you have not been exposed.
And maybe I just wanted to add that we do, Lewis is located in a place where there are a lot of available health resources, and testing is available locally for anyone who's, obviously it's part of the contact tracing process we just described and so on. And so we're not saying that it's not around, and we are talking about ways of bringing it into our campus or our dynamics of how we're approaching this as a mitigation factor and so on. But it's not, what we're hearing from Lori, from all of the authorities, it's not a useful entry tool or screening tool. I guess that leads me to ask, this is really my last question before I feel satisfied with the day, is Lori, do you have any advice for, anything you want to emphasize, I should say, for people who are coming to campus for the first time, since the spring or for the first time ever, in terms of
Sure.
reminders about things?
Well, the role of the campus nurse has definitely changed. We love our jobs and we love serving our students. This semester is going to look a little different than it has in the past, but we're still here as a resource for you. So as an example, before COVID, if you woke up with a sore throat, you could just walk right over to the health center and we would see you and assess you and go from there. We are going to appointments only, and we need to do a phone screening with you. One of the nurses will talk directly with you to assess that. We will still have access to the nurses for students, and we still have access to our physicians. It's just going to look like a little bit of a different delivery model. We do have over-the-counter medications that are still free, and we can make arrangements to get those to you. But I think the biggest change is going to be that it's not walk-in. We will be updating our webpage with a current overview of our service delivery, but we are still going to be here for you. It's just going to look a little bit different. And we're going to adapt as we get new guidelines.
Great, thank you. I think we're...
Yeah, I think that's great. We appreciate, those of you that watch us live and those of you that watch it later because you're busy right now. We appreciate that you're with us. We really want to say, special thanks to Kurt and Lori for being with us today. All of our guests over the last, 4 months have really helped us to inform the broader community about how we're reacting to, many simultaneous things that are changing us as a university. But I'm really grateful to Lori and Kurt for joining us today. Of course, really grateful to you, Chris, for helping me and being such a resource, and to all of the people on the teams that are preparing for the start of the year. I just don't think I can say often enough how grateful I am to the community of professionals that work at Lewis, from our faculty to our staff across the whole university, who have been working so hard this summer to prepare for your return as students. We're excited to have you back. Please, if you haven't yet signed the acknowledgement, please go to the flyer promise. Go to the acknowledgement page, go through it, click on the bottom of it. If you have any questions, wherever they are supposed to go, whether in the finance office or registering for classes, or questions you have about access to technology resources that we talked about, or if you feel that you've lost a job or your parents have lost a job, we've helped 500 families so far with the COVID-19 fund. So there's a lot of resources. We're excited to have you back. We hope you have a great week, and we'll be back. Oh, one more thing. Oh, and I forgot. I was supposed to do this. So as we wrap up today, I'd ask you to stick around. We are going to play a couple of videos. We're creating more and more videos. Lori kind of mentioned some of these also. We're creating videos because not everybody gets all this information by reading a website. So after we wrap up here in 5 seconds here as I say goodbye, Please stick around and watch a couple of these videos that have been done. We appreciate you watching, and many blessings to you and your family.
Welcome, students. When attending in-person classes,
Nice.
we expect our students to follow the Flyers Promise to help everyone stay safe and healthy. To accommodate for proper physical distancing in each class, furniture has been rearranged and class sizes have been reduced. While waiting for your class to begin, please observe physical distancing. Scan the QR code at the entrance of the classroom before entering the room. Students and faculty will be required to wear face coverings throughout the entire class. Students will be asked to sit in seats marked with either an A or B for that class period. They will be asked to sit in that same seat for every class thereafter. Cleaning supplies are available if a student wants to disinfect their own area. While leaving, we ask that students refrain from socializing on the way out and remain physically distanced while they proceed through the door labeled Exit. Lewis University is committed to providing a safe and healthy environment. Thank you for observing the Flyers Promise. Welcome, resident students. We expect our student residents to observe the Flyers Promise to help everyone stay safe and healthy. Please follow the signs posted about elevator capacity, stairwell usage, physical distancing, and cleaning. Hand sanitizer dispensers are available in common and high traffic areas. Be courteous to your neighbors by maintaining CDC recommended physical distancing and wearing face coverings in all common spaces. Be mindful that each resident can host only one Lewis University student guest within his or her residence hall room, and no overnight guests are permitted. In an effort to augment custodial services, cleaning and disinfecting of bathrooms, we ask resident students to help with cleaning and disinfecting of various common areas. Students residing